Hello everyone, I'm Natalie Kunzman, MD, and today we are talking about teen suicide. So there are a lot of causes and indicators, but the number one cause seems to be depression, and that seems to be in at least 75% of the cases, and that probably does not come as a surprise. So those teens sometimes will come from divorced parents. There may be violence in the home. They may have the inability to find success in the school system. They have a lot of feelings of worthlessness. They may be rejected in one way or another by their friends or their peers. There may be some substance abuse involved, or they may have the death of someone very close to the teenager, or they may have the suicide of a friend or someone they have known online. Now, having issues that negatively impact the self-esteem, such as obesity or peer problems or long-term bullying or academic problems, can certainly be part of this phenomenon. Now, having been the victim or a witness of violence, such as physical or sexual abuse, also may be a huge contributor to a teen with a propensity for suicide. Now, what are some of the warning signs that we can actually see? Well, they begin to potentially act recklessly and engage in risk-taking behaviors. Or they may start talking about the death or a suicide, or maybe even be joking about that topic. There may be plans to actually kill him or herself. They may start expressing worries that nobody cares about him or her. Obviously, if they have attempted suicide in the past, much higher risk for suicide now. If there is withdrawal from interacting from friends and family, this also may be a warning sign. Obviously, if they are showing signs of depression, or if substance abuse is a problem, or if they begin to give away sentimental possessions or items, if they start spending time online interacting with those people that really glamorize suicide, or maybe developing suicide pacts. So obviously, preventing suicide is essentially preventing depression. Now, teens will manifest their stress and depressive symptoms somewhat differently than adults, and this is something I see very commonly in my office setting. Now, don't forget, the reason this is somewhat different is that teens are still sometimes egocentric. They are certainly very impulsive, and they have minimal ability to see the finality of their actions. Their brains are still developing some neural pathways, and those pathways may be quite erratic, especially during puberty growth spurts. Let alone if those triggers we mentioned pervade the daily existence in their lives. They may have minimal ability to cope with these stressors or be resilient and okay in spite of them. So, depression in teens might look like loss of interest. So obviously the teen may lose interest in their extracurricular activities or hobbies that they previously joined in. Very, very common that I see are sleep disturbances, and it can be anything from nightmares to insomnia to hypersomnia. They may have a change in their eating habits. So if there's a sudden weight loss or weight gain, parents, please pay attention. The kids may withdraw socially. So they may begin to avoid the social gatherings at their school events, or maybe even the family celebrations. A lot of times these teens will be complaining of fatigue and malaise, and it may actually be quite profound. One of the most common that I see is a marked decline in academic performance. Obviously, that means their grades may have a precipitous drop, and they may have difficulty concentrating to maintain the grades, completing or not completing their assignments and having difficulty staying on task. And again, parents, pay attention. They may start exhibiting self-harming behavior. A common one is cutting or pulling their hair, which is called trichotillomania. Kids who are exhibiting signs of depression may have what we call somatic symptoms, the mind-body connection. So they may have very vague complaints such as daily headaches, pains, stomach problems. But one that might be very obvious to parents is when that depressed teen becomes hostile and angry, and they may have easily frustration and agitated and angry outbursts. With that may come the mood swings of the highs and lows. Of course, if you start noticing substance abuse, this is a high indicator that that child is self-medicating. Obviously, before, as we talked about, if there is talk now of death and suicide, much more pervasively so, pay attention. So, depression triggers, these may be obvious, but if the teen has other mental health conditions such as ADHD or bipolar or anorexia or bulimia, they have a higher preponderance for depression. And again, if they are having the learning disability that may be untreated or unhelped. If the teen has an ongoing pain or chronic physical condition such as cancers or autoimmunity or diabetes or asthma, that makes them higher risk for mental health disorders such as the depression we're talking about. Now, if they have certain personality traits such as low self-esteem or being overly needy or dependent or pessimistic, that makes them at higher risk for depression. If they are abusing alcohol, nicotine, other drugs, again, pay attention. This is a big one, parents. If the child is gay, lesbian, bisexual, transgender, and there is not a supportive environment, this places that teen at a very high risk of depression. So working with a depressed teen, there are several things I might recommend, plus there are many others, but clean up your household behaviors. Listen to your teen. Give less advice and allow them to start making some decisions out loud and create that supportive environment for them. And be compassionate. Don't blow them off. Really be an active listener. Love unconditionally, no matter who your teen is. Give them reassurance that many times they are on the right track. Help them with skills for growth. And even a teen could benefit from meditation, daily exercise, journaling their feelings. I also would like to encourage activities. And these are activities far outside the staying in the basement and playing video games and having online friends. That is not the same. Maybe we need them to volunteer in peer groups. Every kid needs a something. So gently push for any outside group or activity so they can find their tribe. Part-time jobs really help with self-esteem. And again, if I have said it once, I have said it 300 times, pay attention. Any changes may need intervention. Call for professional help whenever you think you need it, even if you think you're being premature or you're not quite sure. Again, it is not always about a pill, but medication may be necessary. There are many complementary ways to calm an agitated brain and aid in depression. So, of course, I do a lot of holistic work. So there may be energy work, breath work, dietary changes, creative visualization, EMDR, lens, meditation, yoga, plus many more. Again, be their backbone and encourage other trusted family members to reach out. Don't forget, there are suicide and depression hotlines, and we need to keep our teens safe. Again, I'm Natalie Kunzman, MD. Leave your comments below. subscribe to my channel, and please forward to anybody you think is in need of this discussion. Natalie Kunzman, MD, and until we meet again, be well.